My paper was electrolyte transport properties in distal small airways from cystic fibrosis pigs with implications for host defense. This paper was written by Xiaopeng Li, Zhao Tang, and others. This is presented by myself, Connor Gray. Just a basic overview of what cystic fibrosis is. Cystic fibrosis is a genetic disease caused by a defect in the membrane-bound channel, which is called cystic fibrosis transmembrane conductance regulator. Lung disease is the main cause of morbidity and mortality for cystic fibrosis patients. This usually results in either death or these patients need lung transport or a transplant. Symptoms of lung disease include bacterial colonization, chronic infection, and mucus plugging in both large and small airways. In the U.S., the median predicted age for survival for patients with cystic fibrosis is in the mid-30s. Just another overview of what the cystic fibrosis transmembrane conductance regulator channel is. And this is an anion channel that is permeable to both chloride ions and bicarbonate ions. When ATP binds to this channel, it induces a conformational change to open and close the gate and allow these ions to flow down the concentration gate. This channel is found in epithelial cells in the lung, liver, pancreas, digestive tract, and reproductive tract, and in the skin. This is why there is the salt test you can do the lick test of their cystic fibrosis patient's skin and see if it's salty. A mutation of this channel causes thick mucus in the lungs. How they performed this experiment was they dissected out the airway tree, which includes the trachea, mainstem bronchi, and distal small airways. Then they isolated large and small airway epithelial cells, and then these were expanded. These were expanded by they grew these cells on plates with keratinocyte growth factor until these cells were the sizes match from previous measurements when they dissected out the airway tree. They used apical amiloride, which inhibits epithelial sodium channels, and it increases the driving force of the chloride ions. And next they use DIDS, which blocks calcium activated chloride ions. And then next they use forskolin and IBMX, which increase the cellular levels of cyclic AMP, which then increase the activity of the cystic fibrosis transmembrane conductance regulator channel. And then next they use GlyH101, which is a inhibitor of the channel, so it will block the chloride current. Then after using all these reagents, they measure the current after each administration of each reagent. Then after this, they tested the bacteria killing within the airways and the lung, and they performed two assays: the luminescent-based antibacterial assay and a grid-based assay. And they did this by coating wells with the epithelial cells of the airway, and then they exposed these cells to a bacteria strain, and then they counted all live and dead bacteria within the well underneath the microscope at 60x to 4 to 5 with 4 to 5 different field of views. In this figure, they measured the current of chloride ions, and they did this on the y-axis, which is measured in microamps per centimeter squared. And on the x-axis, they listed all the reagents. In figure A, they measured within the non-cystic fibrosis pigs, and the smaller airways had increased current, increase or a higher average current. And in B, there was the measurement of the cystic fibrosis pigs, and there was a lower average current than with the non-cystic fibrosis pigs. And in each of C, D, E, and F, they're measuring the currents of each individual reagent, and they're comparing them. From these figures, you can conclude that cystic fibrosis cells, the median current was smaller in both large and in smaller airways. And they also concluded that the amiloride current was similar in both non-cystic fibrosis pigs and cystic fibrosis pigs. They also concluded that the DIDS current was not statistically different from within the cystic fibrosis pigs and the non-cystic fibrosis pigs. Then they concluded that the cyclic AMP current was greater in smaller airways in non-cystic fibrosis than in large airways in non-cystic fibrosis pigs. They also concluded that GlyH101 produced a greater decrease in current in non-cystic fibrosis small airways than in large airways. This figure is one of the figures measuring the bacteria killing capability of the cells. In figure B, it's a control, and it's the relative light units, which were the dead epithelial cells with no bacteria killing ability. And in cystic fibrosis pigs, it was increased. And then they measured the amount of live SA43, which is a strain of bacteria, and there's a significant increase in the amount of live bacteria within the airways. Concluded that there was a significant impairment of bacteria killing in cystic fibrosis small airway cells. My questions are: in a healthy patient, what mechanism is used to prevent the bacterial colonization and bacterial infections in the airways? My second question is: there is a drug that targets the CFTR. What do you think it does to this channel?